Brian Mazanec's Deputy Assistant Secretary in the Center for Preparedness at ASPR at HHS. Brian, welcome. It's great to talk to you again. Thanks for joining me. What's the current state of the cybersecurity landscape for the healthcare sector right now, and how does that inform the way that you at HHS interact with the healthcare sector?
Yeah, first, thanks for having me. I think that's a great question. We look at healthcare and public health sector, cybersecurity, and as we look year over year, we're seeing that the threat landscape is only getting worse. We're seeing increasing sophistication, increasing frequency of cyber attacks against healthcare, and we're particularly concerned, while every critical infrastructure sector is important, in healthcare, it touches the lives of every American, and we're focused on patient health and safety. And unfortunately, some of these cyber attacks, particularly the ransomware attacks against hospitals, healthcare delivery organizations, can really threaten patient health and safety and the lives of Americans. So we are very much focused on this threat, but the adversary is using new and more sophisticated technologies, continues to attack legacy medical devices that are obviously spread throughout the healthcare ecosystem. It's really, unfortunately, a lucrative landscape for the adversary. So we are working hard to level up our efforts to meet that threat and protect Americans.
Does the prevalence of ransomware in the healthcare sector mean that you approach the sector differently than other government agencies might approach the sectors with which they work?
I'm not sure if it means we approach it differently. It certainly, I think it increases the urgency because ransomware in particular, we're worried about all cyber threats and protecting intellectual property and those kind of things. But ransomware poses real health and safety issues. If you lock down in a hospital, for example, the radiology, the CT scanners, and you have in an emergency room patients who need critical care, they won't be able to receive it if the doctors in the ER can't use a CT scanner, for example. So there's an urgency there to meet this threat that I think may be a little more pronounced and timely than for some of the other critical infrastructure sectors. But we do work with our federal partners across those other sectors, share best practices. There are some areas of commonality as well, but ransomware is driven by the financial incentives for these bad actors. And unfortunately, healthcare pays. A lot of these hospitals have ransomware coverage, and we'll see ransom demands. They're not dumb. They know that there's coverage. They know what the coverage often will be. We'll see ransomware demand letters that will be exactly at the payout amount of the particular victim's coverage. So as long as you have these perverse incentives and it's a sector that pays because of the importance of protecting patient health and safety, it's really a dire threat that we're trying to level up to meet.
Is there a role for your team or for other teams across government to try to take action or advocate for action that will change that incentive structure?
Absolutely. So I think part of the way you change the adversary calculus is just by hardening the sector. So we've identified a little over a year and a half ago, we put out healthcare and public health specific cybersecurity performance goals. We call them government acronyms, CPGs. CISA has put out, there's all sector, cross-sector CPGs, but we created, based on our work with the sector and what we had seen, tailored CPGs that identify the 10 highest impact practices that healthcare entities can implement to immediately harden their systems and increase their resiliency, which will affect that adversary calculus. Of course, there are other things we can do too, and certainly other parts of government are taking more offensive measures to go after these adversaries. We work very closely with the FBI and others, and they have a very different but critical role in affecting that as well. But it's really a team effort across the federal government and with the private sector too. We have really robust private sector partnerships that are also really important.
You saw my next question coming, Brian, and that is, who are your partners across government? You mentioned FBI. You talked about partnerships earlier. I imagine CISA is another organization that you work pretty tightly with.
So first of all, the partnerships begin within just HHS. So the organization I sit in, the Administration for Strategic Preparedness and Response, we serve as kind of the quarterback or a coordination node for the department, particularly from an incident response perspective. But there's so many other parts of HHS that play absolutely critical roles. The Office of the Chief Information Officer, FDA has a medical device cybersecurity regulatory role. CMS is so directly involved in healthcare across the nation and has a really critical role there. So we coordinate just within the department with really dozens of partners on a daily basis. And then within the federal interagency, as I mentioned, FBI, from a law enforcement perspective, really going after the bad actors. They're critical partners. Often a victim will first engage, because the FBI has the lead in federal response, they'll first maybe engage with the FBI or CISA, but the three of us quickly work together to bring our different tools in our toolkit to bear. Our role at HHS is really hardening the sector, helping it improve its cyber resiliency, and then in an actual incident response role, we're focused on mitigating patient health and safety impacts. So we have unique tools we can bring, in addition to the role FBI is playing from a law enforcement perspective, CISA may be playing from a technical cyber perspective. We can bring certain tools and resources to basically prevent loss of life or really adverse impacts on patients.
You mentioned you interact too with organizations across government that perform similar functions in liaison with other sectors, and I think of CISA, the office at the Energy Department first. What does that collaboration look like? How do you what do you exchange among yourselves to understand what's going on in other sectors that might be coming to yours?
Yeah, so we focus a lot, and there's obvious touch points of critical cross-sector dependencies. You mentioned CISA, energy. You can't run a hospital very long without power, without water. Wastewater is another critical infrastructure sector with EPA. So we work closely on a regular basis with those sectors because there are mutual points of interest. And then CISA, on behalf of all of the critical infrastructure sectors and as the national coordinator, brings us together on a regular basis to work on those broader cross-cutting issues that affect every critical infrastructure sector. So we're fortunate to have CISA playing that role as a key partner as well.
Okay, final thought. What's the long-term view? What are you paying attention to now that might not be on the radar screens of the folks that you deal with in the healthcare sector today, but you're helping to educate them or prepare them?
Yeah, well, I don't know if this is not on the radar. I think everyone's talking about AI, but really the technology changes, what it means from a workforce perspective, what kind of skills we need and that the sector needs to deal with evolving threats that are just moving at a scale and speed with automation, with large language models that are changing the game and the calculus. And really, we're trying to do a lot of work to help the sector grapple with that. Again, I think that's on their radar too, but it's a wicked problem that we need to work together on.
Brian, it's great to have you here. Thanks very much for joining me.
Thank you. Appreciate the opportunity.